My name is Miranda Marlowe, and this Web of Causation project is over obesity in adults with developmental disabilities. Obesity, according to the CDC, is a label for weight that is considered greater than what is generally considered healthy. Obesity has been shown to increase the likelihood of certain diseases and other health problems. For adults, obesity ranges are determined by using weight and height to calculate a number called the body mass index, or BMI. An adult with a BMI between 25 and 29.9 is considered overweight. An adult who has a BMI of 30 or higher is considered obese. Okay, let's talk about prevalence. 23% of adults in the United States are considered obese. That is 1/4 of the population. 36% of adults with disabilities in the U.S. are obese. That's 13% higher than the average obesity of the citizens of the United States. Obesity prevalence is higher among people with developmental disabilities than for people without disabilities, and it's an important risk factor for other health conditions. So let's talk about the determinants of obesity in adults with developmental disabilities. Hooverkamp, Scanlon, and Roth found that those diagnosed with a developmental disability were more likely to lead a sedentary lifestyle. They were also found that adults with developmental disabilities had an alarmingly high rate of inadequate emotional support. A study by Ptolemy, Goetz, Lee, Donnelly, and Sullivan found that adults with developmental disabilities had a more unhealthy diet than the average American. They do not consume enough fruit, whole grains, and vegetables. They found that as participants' weight increased, the consumption of total fruit, whole fruit, total vegetables, dark green and orange vegetables, and whole grains decreased. This may suggest that eating more fruits, vegetables, and whole grains may be influential in weight management and preventing obesity altogether. An article published in the American Journal on Intellect and Developmental Disabilities found that obesity prevalence differed based on living arrangements. Those living in institutional settings had the lowest rate, while individuals living in their own home had the highest. Individuals living in an agency apartment and in their own home had the same rates of obesity, while those living in a group home had the same rate as those in an institution. This may have something to do with the fact that when people are living in an institution, they have meals that are regularly scheduled for them, already prepared, and may be healthier than those who are living at home and do not have access to healthier food options or knowledge about this. Johnson, Hobson, Garcia, and Matthews discovered through their research increased risk of obesity associated with adults with developmental disabilities. They concluded this to be because of their poor eating habits. They found in their study that poor eating habits were a result of the lack of nutrition education and food skills programs for this population. Mulrooney found that obesity in adults with learning disabilities is multifactorial in origin. The risk of obesity is higher because of behavioral, biological, psychological, and sociological factors. These include using food as a coping mechanism, effects of medication, effects of the disease, lack of understanding in order to make healthy choices, and/or a lack of support. Crowley and Geller believe stress and loneliness are determinants of obesity. As a result, they have created a model that focuses more on reducing loneliness and stress by empowering participants with more traditional education and physical activity-based programs. Finally, the last two research articles. Heller and Sorensen found that lack of exercise and nutrition education were contributing factors to higher rates of obesity in adults with developmental disabilities. Increasing exercise and nutrition education can not only reduce weight, but also change health behavior attitudes, such as exercise self-efficacy, outcomes expectations, and decreasing barriers. The ARC, which is a nonprofit organization that I will talk about later, found that a lack of accessible resources for those with developmental disabilities increased the rates of obesity in this population. We will talk more about what these resources are later. So, just to summarize all of the determinants that I have found through my research, sedentary lifestyle, lack of emotional support, a diet, living arrangements, lack of accessible resources, lack of nutrition education, stress, and loneliness are all reasons that obesity in this population is higher than that of the rest of the population in the United States. Now for our web of causation. It is important to note how these different determinants interact with one another and correlate together, such as lack of exercise education and sedentary lifestyle are correlated and are both determinants and increase obesity among adults with developmental disabilities. Lack of resources is a determinant and a causation. Stress, loneliness, and lack of emotional support are all interconnected and increase to obesity. Lack of food skills programs, diet, and lack of nutrition education are all correlated, as well as diet and living arrangements are correlated, and these increase obesity among adults with developmental disabilities. Let's talk about the social work perspective and how social work sees obesity in this population as a problem. Ward, Nicholson, and Friedman found that little research is documented on health disparities in individuals with developmental disabilities. I can agree with this statement as I was doing my literature review about this topic and had trouble finding information about obesity in this population. Therefore, they conducted focus groups and found out that the four main areas of inequalities that exist are access, knowledge, communication, and quality. This is an important social work perspective as it lends itself to empowerment in this population, as their voice is being heard. Ward, Nicholson, and Freeman allowed those with developmental disabilities to speak out about what they saw their health inequalities to be and empowered them to know and understand these inequalities. Let's talk about how the community is responding to this issue. The ARC, as I mentioned in my literature review, is the nation's leading community-based nonprofit organization for people with intellectual and developmental disabilities. It completely supports opportunities for the people they advocate for to use community services alongside their peers without disabilities. The goals of the ARC, which are very important, are to promote and protect the human rights of those with developmental disabilities. They actively support their full inclusion and participation in the community. The main component of this organization that I want to talk about that primarily relates to obesity is Health Meet. This is a program that is grant funded by the Center for Disease Control, and they received over $900,000 as a grant to run and implement this program. Health Meet works to reduce health disparities and increase longevity and quality of life. They do this through community-based health screenings among their 700 nationwide participants and providers. They provide trainings and education to these individuals, their families, direct service professionals, medical providers, and etc. They raise public awareness of health issues that impact people with intellectual and developmental disabilities. Unfortunately, this program has not yet been tested for effectiveness, as the grant has just recently been awarded and the program has just recently began implementation. Let's talk about health-related policies. To begin with, let's talk about H.R. 2415, Treat and Reduce Obesity, 2013. This bill would affect everyone who is obese. The goals of this policy are to provide Medicare recipients and their health care providers with tools to treat and reduce obesity. This is done through improving access to services and to provide new prescription drugs that could help with weight management. Unfortunately, this policy has not yet been passed, therefore it has not been tested for effectiveness. Now, to conclude my presentation, there are a few things I want you to remember and take away. There is an increased prevalence of obesity among individuals with developmental disabilities. Determinants of obesity in these individuals include a sedentary lifestyle, lack of exercise, lack of emotional support, diet, living arrangements, lack of accessible resources, lack of nutrition education, stress, and loneliness. There is becoming increased awareness of this issue, and policies and programs are being created to change it. And these are my resources. Thank you.